So I'm going to review my patient's history, checking for any nosebleeds, any aspirations, any anticoagulant therapies, also any sinus infection, any nasal polyps, and also any recent oral, facial, or sinus surgery. I'm going to identify my patient with two identifiers, name and date of birth. I'm going to verify my provider's orders. I'm going to provide privacy for my patient, and then I'm going to hand hygiene, and I'm going to get my supplies ready on a clean surface. We'll use this for my tissue, put that in the patient's reach. We'll use this for an Emerson basin and put that in the patient's reach. I have also 2 cups, one filled with water. We'll give that to the patient for her to swallow while I'm inserting, and 1 empty cup. I'm going to explain to the patient that today I will be inserting a nasogastric tube because the provider orders it. I want to ask the patient, does she have any questions about the procedure, and I also want to get a verbal consent from her. I want to make sure that she's not having any pain, any vomiting, or any nausea. I'm going to raise the head of the bed to a high phyllis position, and I'm also going to raise the bed entirety to waist level so that I'm comfortable while doing the procedure. And I'm going to go ahead and hand hygiene. I'm going to get my tape ready. And I'm going to grab some gloves. Next, I'm going to take my pen light and assess the patient's nerves, looking for any obstruction, any signs of any type of infection, any drainage, any nasal polyps, and everything is okay. The next thing I'm going to do is check the patient's nerve patency, holding one side of the nose, asking her to breathe in, holding the other side of the nose and asking her to breathe in. I will then check my patient's gag reflex. And at this time, I'm going to go ahead and auscultate the lungs and the bowel sound. I will also provide my patient with a towel. And I'll do the lung sounds on myself. Then I'm going to check the bowel sound, so I'll go right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay. I am now going to measure the tube compared to the patient, and since I'll use myself to measure. You want to make sure that you measure from the tip of the nose to the peanut of the ear, and then also down to the sternum. Okay, and you want to mark that with a piece of tape. going to get my lubricant ready. And before I begin, I want to verify with the patient one more time. Has she had any recent trauma, any nosebleeds, or any surgeries with her nose? Now I'm going to lubricate my tube. I'm going to advise the patient that she's going to feel some pressure, and I'm also going to ask the patient to bring her chin to her chest while inserting the tube to close off the epiglottis for easier insertion. I'm going to go ahead and insert the tube. Okay, I'm going to take my syringe and I'm going to aspirate. This syringe will be 35 to 60 milliliters. And I will aspirate the fluid, the gastric fluid, to make sure that I'm inside of the stomach. I have my cup here. Empty those fluids into the cup. And then I have my pH strip to check the pH. Okay, everything looks good. I'm going to discard of that. I'm going to go ahead and tape my patient. And then I'm going to tape the gastric tube to the patient's gown. Provided that I had a clamp, I would also clamp it to the patient. I'm going to remove my gloves, perform hand hygiene. Now, I'm going to go ahead and explain to my patient that we're going to go ahead and remove that tube. Advise the patient that she may feel some pressure, and I'm going to ask her to hold her breath as I take the nasogastric tube out of her nose. So, I'm going to go ahead and hand hygiene. I'm going to put on some gloves. I'm going to go ahead and unclamp that from the patient. Take the tape off the patient's gown. Remove the tape from the patient's nose. And as stated before, I'm going to advise the patient to hold her breath while I remove the tube. After removing the tube, I'm going to inspect the tube and make sure there's no defects in the tube. I'm going to take all my supplies and discard of them. I'm going to remove my gloves, hand hygiene. At this time, I'll reassess the patient's comfort level, make sure the patient isn't having any pain after removing the tube. I'm going to go ahead and lower the bed to its lowest position and I am going to make sure that the patient has her call light and also make sure that the bed is locked. And this completes my video of the nasogastric tube insertion and removal.